This is our PowerPoint on Parkinson's disease. My name is Stephanie Wilkinson. I am a post-baccalaureate student who is pursuing a degree in biology. I work as a speech-language pathologist with children who have speech, language, and hearing disorders, and I love to read and travel.
Hi, my name is Tiara Jessup, and I am a junior public health major. I enjoy reading, traveling, and making people smile. My passions are children and maternal women.
My name is Alexandra Harrington. I am a junior majoring in public health. I enjoy reading various books and doing crafts from Pinterest. There is no exact date when Parkinson's disease was first diagnosed. James Parkinson was the first to do research in 1817. He received no help in his research because Parkinson's disease was not heard of and it was not a popular disease to research. In 1861, Jean Martin Charcot used the information from James Parkinson's essay to do further research. Charcot and Parkinson set the foundation for studies and research on Parkinson's disease. There are different factors that play a part in Parkinson's disease. A study showed how age increased likelihood also increased. Work environment with high levels of pesticide and heavy metals increased chances of Parkinson's disease. Individuals with high, moderate to vigorous physical activity have lower incidence of Parkinson's disease.
Parkinson's disease is an age-related neurodegenerative disorder that affects approximately 1 million persons in the United States. It is characterized by resting tremor, rigidity, bradykinesia or slowness, gait disturbance, and postural instability. The specific cause of Parkinson's disease is not known, but there are many factors that contribute to the cause. Some are environmental and some are genetic. Exposure to well water, pesticides, herbicides, industrial chemicals, wood pulp mills, farming, and living in a rural environment are all environmental factors. A genetic factor is that about 5 to 10% of Parkinson's disease patients have a familial form of Parkinson's with an autosomal dominant pattern of inheritance. Oxidative stress has gotten a lot of attention because of the potential of the oxidative metabolism of dopamine to yield hydrogen peroxide. Contrary to other illnesses, there is no specific test to diagnose Parkinson's disease. Because of the close similarity of symptoms Parkinson's has with other neurological disorders, it is difficult to accurately diagnose. However, a diagnosis is made by a physician based on family history, review of signs and symptoms, physical exams, and a neurological exam. There are 4 main symptoms: shaking or tremor, slowness of movement, rigidity of arms, legs, and/or trunk, and trouble with balance. In order to diagnose, a patient must have 2 of the 4 main symptoms. The following slides continue to talk about diagnosis and the DAT scan imaging.
Currently, there is no cure for Parkinson's disease, but there are drug therapies to help manage symptoms. Depending on the progression of Parkinson's disease, surgical intervention may be necessary.
There are 3 categories that medications for the treatment of Parkinson's disease fall into. The first are that drugs that work directly or indirectly to increase the level of dopamine in the brain. Second, drugs attempting to ease symptoms, and third, drugs that help control the non-motor symptoms of Parkinson's. The following slides go into great detail on drug therapies.
If a patient does not respond to drug therapy, surgery may be necessary. One surgical intervention is DBS, deep brain stimulation. DBS is a device that sends electrical pulses to the patient's brain. DBS helps stabilize the symptoms.
Usually after a treatment plan is established, patients typically slow improvement of their symptoms. The patient must continue to work closely with the team of medical care providers as the disease progresses.
There is no clear set goals in public health due to the fact that there is a substantial amount of research and studying being conducted by neurologists, epidemiologists, and other officials in the public health setting. Strategies are early detection, diagnosis, and proper treatment.
Healthy People 2020. The goals for Parkinson's disease is to reduce the prevalence and severity of disorders of hearing and balance, smell and taste, and voice, speech, and language. The objective is to reduce the proportion of adults with chemosensory smell and taste disorders who as a result have experienced a negative impact on their general health status, work, or quality of life in the past 12 months.
These are our resources used to present this presentation.
Thank you.